So it's actually a very interesting thing to understand. Both men and women have estrogen and testosterone. Testosterone is the male hormone, estrogen is the female. Both of us have both of them, but men have this testosterone and women have this testosterone. And we have this estrogen and men have this estrogen. Now, as our estrogen levels fall, what happens is you can see our testosterone more. In other words, our testosterone becomes prominent because it's not that it increases, it's there, but we now have less estrogen than testosterone. And testosterone is the male hormone, but it's also a hormone that is associated with male pattern baldness, with increased facial hair growth, hair on the chest, acne. So a lot of women in menopause start to get these things: the thinning, the bald in the middle of the hair, the facial hair growth, the irregular periods, the acne again. There's some young women actually who also have evidence of that, but that is a clinical condition where their ovaries are not producing enough estrogen and they are seeing their testosterone. So it's called hyperandrogenism. Long fancy word, but androgens are things like testosterone, male hormones. So some women do experience that. So these are attributed to the relative increase in the effects of testosterone. I kind of went on to this a little bit before I jumped it. Menopause itself does not predispose you to depression. However, there's so many things happening in a woman's life at the time of menopause that it may precipitate this mood change, and it may be serious. So changing relationships, divorce, illness, suddenly becoming aware of your own mortality, which I am very much aware of as, people my age, people you know and love are just dying. Illness, aging, parents dying, losing a job, children leaving home, and suddenly this man you've been living with for ages, who you mainly spoke about around issues of the children are now gone, and you have to find this new conversation to have with this guy, bearing in mind that you're not the 20-year-old he met. You can't swing from the chandeliers upside down, And so he has some adjusting to do too, aching bones and all that, So it's a difficult time, and and should not really be underplayed. It's something that you always have to bear in mind. I briefly wanted to talk about surgical menopause. So if we could go back, just in your imagination, the map of the drawing of the body. If I take out your uterus alone, you want to go right back to it? Okay. So if I take out your uterus alone, it was this first or second, that is called a hysterectomy. And we do that surgical procedure. We do that surgical procedure for lots of reasons, but the most common one I would say is probably fibroids, right? So women who have massive fibroids, which are these benign tumors that grow in a lot of women, in particular black women, if you remove that hysterectomy, the ovaries are left behind, especially if you are young, so that you can still produce hormones, so you still have the same feelings, you still have the same moisture, you still have the same suppleness of your skin. Everything is good, except you're just not having periods. It's heavenly, actually. It's quite great. Of course, it's not so great if you haven't had children and you want them. But if you've completed your family, you have the hysterectomy, life is good. If, however, you have to take the ovaries out for one reason or another, and one of the kind of rules we have in gynecology is that if they open you up to do a hysterectomy, the doctor always examines your ovaries. Because if they examine it and they see a tumor or a mass, it comes out. They tell you about it when you wake up, because it's no point zipping you back up and then next time saying, oh, we saw this funny thing on your ovary, and then we have to now go back in, right? So they always examine the ovaries when they do have you open, and and remove it if there's a mass. I actually did mine the other way around. I had an ovarian tumor, and so I was going to have my right ovary removed. So when I went to sign the consent form, Dr. Derek Jeffers did it for me. I thought, but you know what, while he's there, why do I need to keep my uterus, and why do I need anything? So I wrote, I consent to have a left oophorectomy, which is the removal of my left ovaries, right oophorectomy, hysterectomy, and tummy tuck. And he got very angry with me. Oh, this is a legal document. Why are you writing all these things on it? But I thought, you know, while you're there, just fix everything up one time. Anyway, he did have to take out everything because my right ovary was stuck to some part of my gut and my uterus had fibroids. So he did take everything. So I woke up and he said, right, that's it. I had to take everything out. So the minute I woke up, I was then menopausal. What do you do about that? Well, the good thing is that I can take a hormone to make me feel normal. And we're going to talk a little bit about that. So menopause, after you have a hysterectomy and an oophorectomy, you can become menopausal. And soon after, within months, your estrogen and progesterone levels fall off. And unfortunately, you can get sudden symptoms, and quite major symptoms. I'll tell you how it's treated in a bit because I'm going to look at the other ways we treat. So back to what I said in the beginning, that this is something that occurs in all women who live long enough. Only about 15% of women have significant problems. Most women, not a problem. Life changes, they adjust, and that's great. But there are a few that life becomes really challenging. So for most people, you don't do anything, you enjoy the freedom of having no periods, and you can have great sex, no need for contraception. Life is great. And I think it's a good time for women to begin looking after themselves, if we haven't been doing it before. And a lot of us throughout our lives, we work, we take care of our children, we take care of our partners, we take care of our siblings, we take care of our parents. And suddenly now at this stage in our lives, it's a good time when perhaps we have a little bit more time to say, you know what, I'm going to put myself higher up on the priority list. I'm still struggling. I can get myself up to 3. I haven't yet got myself to 1 or 2. But I'm now at number 3 in my list, and I'm working on it. Hopefully before the Lord comes to me, I'm going to be number 1 in my life. And as I mentioned before, estrogen protects you from some things. Unfortunately, as you're now menopausal, you start to notice that other diseases start to come because you don't have this protective function of estrogen anymore. So you find more women start to get heart disease, diabetes, we get overweight, and a lot of issues with our weight start to, arthritis, endometrial cancer, and all sorts of things. For those who have really tough symptoms, like me, we can introduce in some women something called hormone replacement therapy, or HRT. And in the leaflet I'm leaving with you, there's actually a little leaflet on HRT. Now, when I entered medical school in 1983, HRT was the big thing. Everybody was going to be, oh my goodness. I was like, I can't wait to get there and have HRT. And then, so you're lacking estrogen, so it makes sense. Let me give you estrogen. Well, what they found was that a lot of women who were given estrogen developed cancer of the womb. So estrogen by itself increases the risk of the lining of the womb becoming overactive and becoming cancerous. So that was a no-no. And then they did some more research and they said, well, why don't all women get cancer of the womb? We have estrogen in our body. And then they realized that in our body, in the natural state, we produce progesterone, another hormone, in a small amount for a few days every month. So every cycle, we have estrogen, but progesterone is for a few days every month. And this seems to be protective. So they made the combined HRT, and they put a little progesterone in, and for the past however many years, women like me were happily taking our combined HRT. Then, a few years ago, a big study was produced that said women who take this combined HRT for long periods of time may have an increased risk of a certain kind of breast cancer. So we kind of, pardon the expression to the young men, damned if we do and damned if we don't. What do we do now? Well, what we do as physicians now is that we try and counsel people and say, you know, let's look at the symptoms. We treat the symptoms as best as we can. We do put some women on combined HRT, but only for 5 years. So I have conversations and I'll say, now, if the person says, yes, so at 5 years, what's going to happen? You know, and I say, well, I'm going to have to take you off. They say, oh my gosh, and then I'm going to feel like this now. Sometimes you do, sometimes you don't. Sometimes just that time is what's needed to adjust. Some people say, you know what, if I'm going to have to deal with this in 5 years, let me deal with it now, and they just deal with it. I have one patient who actually read the study before me, and she marched into my office and said, don't you dare think you are taking me off of these. And she actually was a mature woman, and she had got married to a younger man. She had got married when she was 70 to a guy who was 45. And she said, no way. And she said, I accept the risk. I understand that I've been taking it, because she had had a hysterectomy when she was much younger. And I accept the risk, and I mean, that's a personal choice, and she's still going strong, no cancer, nothing. And she's older now, even older now. So it's a personal decision, but from our point of view, we should not be advising women to stay on combined HRT for longer than 5 years because of the risk of breast cancer. For women like me who have a hysterectomy, it's actually quite easy because I don't have a uterus. So I can't get cancer of something I don't have. So I take estrogen by itself every day. And that makes me feel a little balanced. And sometimes when I forget for like a week or so, I wonder, why am I feeling like this? Why, you know, I don't understand. I'm irritable. And then I think, oh, let me go and look. And I realize, oh my gosh, I haven't taken it for about 4 days. So I do still find it helpful. But eventually there was a point when we couldn't get Premarin, like just before COVID. We couldn't get estrogen replacement, and we had to do without it, and we survived. So what are the other things? So, as I said, doctors may suggest a pill that contains hormones, but you must have a discussion about the risks. You know, ask questions. If you have, for instance, a risk of ovarian cancer in your family, I'm not giving you HRT because this may feed this. So it's a conversation you have to have. For the symptoms like hot flashes, you're going to find that you have to change your style of dress. So here comes the loose clothes. You know, I don't wear belts. I don't wear belts. I've worn belts for about 10 years. You know, loose clothes, mainly cotton or linen, so that it breathes. You know, the polyesters and things like that, it just keeps you too hot. Caffeine. Caffeine dilates your blood vessels, so it gives you hot flashes itself. So reducing your caffeine intake will make you feel more comfortable. That's a challenge for some of us. I'm kind of addicted to Coca-Cola, and that's a problem. But, you know, that's what we aim for. Drinking lots of water. We know that exercise, I don't think I have it mentioned here, but exercise is very important apart from stress reduction and sense of self, you know, well-being. It's very good for the joints. You know, tugging on the bones makes them stronger. So strength training, not just cardio, but strength training, lifting weights, very important for the bones and the joints. As I mentioned before, the water-based lubricants, and please make sure that you know that this is not petroleum jelly. Petroleum jelly is not a lubricant. I'm going to talk to the young men. Petroleum jelly damages condoms. So, you know, when we're talking about lubricating with condoms, it's always KY jelly, which is a water-based lubricant. Petroleum jelly is an oil-based. It's for the skin and the hair or whatever, not for the genitals. There are some estrogen creams that we can give that are inserted and you use it like a couple of times a week, and it keeps the area moist enough for the week. So those are available. And the mood swings, well, I must say in the Caribbean, our mental health care is not the best. And this is throughout the whole region. We're not a culture that has therapists. In the US, everybody has a lawyer, a doctor, and a therapist. That's not part of our culture, and I don't know if it's something that we should think about, but we need to talk about how we're feeling. And I think, good friends are a great source. As I said, your siblings, churches, nurses, getting together so that you can ask questions and say, look, I know this is going to sound weird, but when I wake up in the morning, my heel hurts. I don't know what it is, and I'm wearing flat shoes, but my heel pains me. You ever heard anything like this? And then you're going to find out it's one of the things on my list, that heel pain is one of the menopausal symptoms. And it does get exacerbated by wearing flat shoes or walking barefoot. So you have to get a shoe, a slipper, that has a little heel. So like my draggers, my bedside flip-flops now, I bought ones with a wedge. So as soon as I get up and I put my foot in it, I'm a little bit elevated and I walk to the bathroom. I once had a podiatrist tell me, if you can't get the wedge slipper, walk on tiptoe until you've walked for a bit, then put your heel down. But heel pain is a significant thing. Now, if I didn't talk to women about this, you just suffer in silence, and it's actually caused by something called plantar fasciitis, but it's more common in menopause. So I'm going to leave it there because I don't want to bore you, and I want to hear any questions you have, and we can look at some other things. I just want to put the next one up because I learned this a few years ago, and it's like one of my mottos now. If you're 50 years old and you wake up in the morning and you feel no pain, you're dead. And I love that. That's a Mexican proverb, and it reminds me every day to say thank you. When I wake up and the joints are hurting, I just say, thank you, Lord, I'm here. I'm here for another day. So between this and the fact that menopause is natural, these are the two ends of what govern my day-to-day life, really. So I'm open to any questions. It doesn't even have to be about menopause only, but yes, so yes, go ahead. The question here is, can fibroids mess with your menopause? The answer is no. Because let's go back to the definition of menopause. Menopause is the stopping of your period because of hormone changes. Now, fibroids are fibrous, benign tumors. These balls are like balls of twine that grow in the muscle of the uterus. What they do is they increase the surface area of your uterus, so there's more lining to bleed. So people with lots of fibroids tend to have heavy periods, they may get a tummy that's sticking out, they may get back pains and so on. But all that will stop if you stop producing estrogen, because that's what controls the whole shebang. Okay? So what often I hear, however, just to take this to the next level, is once you become menopausal, my fibroids will shrink. And there's a little truth in it, but not the shrink that we would like. Right? They don't grow, right? So the fibroids stop growing because they love estrogen. Estrogen is their food. But, so now I've taken away their food, so they will shrivel a little bit, but they won't disappear. So the only way to get rid of fibroids is to remove them. And, but they don't cause, for the majority of women, fibroids don't cause a problem. And so we live and we die with our fibroids. If they cause a problem, heavy bleeding, you're anemic, you have back pain, you're just fed up of walking around with a big tummy, then you remove them. And the surgery to remove the fibroid, if it is 1 or 2 and small enough, right. So you can have, so there's a, you wouldn't be able to, they're small, right, so you just ignore them. But if you had, say, 1 big fibroid, you could have a surgery called a myomectomy to remove the fibroid but leave the womb. But if you have a lot of fibroids, like my mother, I remember even now at 13, they showed me and it looked like 3 grapefruits. They were huge. You know, they showed me in a jar, and she had to have a hysterectomy because they couldn't cut into the uterus all those times. So they took the whole womb out. But it doesn't affect, you know, really, yeah.
Good evening, everyone. If a woman prior to menopause had to get surgery to remove everything, so she is surgically menopausal, and refuses HRT, well, it's a kind of twofold question. Is she fully menopausal? Because, as you explained,
yes,
the estrogen...
No estrogen, so you're menopausal. No estrogen, no period.
So when she reaches to a later age, let's say 45, 50, and the body now starts to function like a real menopausal, what do you call that?
No, because surgically, if they've removed her ovaries, tomorrow she is going to be how she's going to be.
So she'll start to experience all
tomorrow,
these symptoms?
Immediately.
Okay.
You know?
So how long does those symptoms last?
Right, so that's a tricky question, because how I think about it, but I may be, you know, perhaps I'm corrected with this, is that a lot of people think menopause is an event, right? So I'm like, a patient comes to me and I say, you know, I think these are menopausal symptoms. Me, I don't go through that. I was menopausal 5 years ago. What are you talking about? I think of menopause as the next phase in my life. I don't think of it as a moment. So my menopause starts when I have had no period for a year as a result of hormone failure, or if I had everything taken out yesterday surgically. That's the start of my menopausal phase. And when they put me in the ground or cremate me, that's the end of my menopausal phase as far as I'm concerned. However, there is this terminology you hear people talk about, postmenopause. And I guess that perhaps is the phase I'm describing. So perhaps menopause is that year, and then postmenopause is from there to death. I don't know.
So the body continuously go through the symptoms?
Yes. Why? Because it's happening because there are no hormones. And you don't have any hormones, so what you got to do? What I think happens is that the brain adjusts a little bit, and our tolerance changes. And, you know, I mean, I don't have palpitations. That's one of the things on the list you'll see also. Palpitations. Suddenly, I'm sitting there at my desk, and brrr, my heart is pumping really fast. And, you know, for a while you think, ooh, what's happening here, what's happening here? Well, now I know it's either I've had too much coffee or it's just one of those menopausal things. So when it happens, now, is it that it's happening less now, or is it that I just don't notice it now? I don't know. Yes, I think I'm getting kind of used to it.
Okay.
Yeah.
Part two to the question, what are the risks or the effects to the body after refusing the HRT but being plunged into menopause surgically?
Yeah, so I think it's, there's, what are the risks? The risks are probably the heart disease, the bone disease, you know, normal things we associate with aging, okay?
It becomes quicker.
Yes, so you know, rather than going nicely, gently into it, you're now going into it right away. But nobody can make you have hormone replacement therapy. I mean, I love hormone replacement therapy. And that elderly patient I told you about, she'd kill me if she heard me say elderly, but that older woman I told you about, she actually has, and I have it stuck up on my clinical board, hooray for HRT. You know, it has made a difference in so many women's life, including my own. So I was like, you know, in fact, after 6 months, I don't know where I got 6 months from, but after 6 months, I called Dr. Jeffers and said, you know, do I have to stop this? And he's like, who told you you have to stop it? And I said, well, I just had this 6 month thing in my mind. And he said, you'll stop it when I tell you to stop it. And he hasn't told me to stop it. And that's 6 years now. So, hello. Any other questions?
Can I ask one? Hearing about the added estrogen, but is there other things that the woman can do, like for example supplements that helps with, because I heard about the calcium.
Yes.
And I think there's some aspects of like brain fogging, like memory. There's a lot of different things happening. So is there supplements that the woman could take as well that helps to bring about some normalcy as well?
Right.
Too?
So that's an excellent question. And unfortunately, I'm going to tell you I'm no expert in this because I suppose I'm a bit tunnel vision with my training. But how I answer that question in my practice is I say, if it is not going to do you any harm, then I don't mind you trying it. So I'll give you some examples. Evening primrose oil. A lot of women, this is a supplement, a natural supplement. A lot of women take evening primrose oil, and some of them say it helps their hot flashes. I say take it. It's not going to do you any harm. There are no clinical studies that show that evening primrose oil actually affects hot flashes any more than sugar affects hot flashes. They've never been able to prove it. And unfortunately, that part of my brain in science, which requires evidence, you know, then I have to reject that. It's the same thing like glucosamine with chondroitin for the joints. They've tried to do studies for glucosamine with chondroitin. 50% of people say, I can't move unless I take my chondroitin and my glucosamine. And 50% say, waste the money, not helping me. And so I say, well, does it harm you? If it doesn't harm you, take it. If it helps you, great. If it doesn't, then don't take it. And that's the problem I have with a lot of the herbal and natural molecule. Nothing natural comes in a bottle. So when I hear people saying all natural and it's coming in a bottle, that's nonsense because it's been processed if it's in a bottle, right? But you know, my grandmother had bushes for everything, right? Everything. Bush for everything. And if somebody knows about bush and they want to take maiden apple and something else and guava and so on, and it's not going to harm you and you feel better doing it, I think that's just the power of the brain. But, you know, way before I existed, people have been doing herbal medicine. It's just that Western medicine has us now, and our lawyers, you know, where we have to be able, when I write you a prescription for 2 paracetamol to take no more than 8 in a day, I do that with the confidence that we have looked at this over years, studied it in hundreds of thousands of people, and 500 milligrams of paracetamol in each tablet, so a gram 4 times a day is going to be fine. I can't tell you that with guava leaves or soursop leaves. You know, is it 2 leaves? Is it 3 leaves? I mean, my grandmother used to tell me it had to be odd leaves. It had to be odd number of leaves. And then I'd say, you know, when I got cheeky, I would say, well, what size leaves? And then you had to draw it, not boil it. You know, and yeah, and there's, I think it's soursop. I think it's soursop. When I was in Jamaica working, there was a young man that came in coma. Unresponsive. I mean, he was alive, unresponsive. And he had been given some bush. And it just put him into a very deep sleep for a very long time. And I was like, yeah. And then they said, oh, he probably boiled it and he shouldn't have boiled it. He should have just dried it. Well, I don't know about that. So I just stick to what I was trained in, and my advice generally is if it does not do you any harm and you feel that it makes you better, go for it. But if it does you harm, you know, or if you're taking something that I think it may interact with, I mean, here's another thing, because, you know, there's this thing called, there's something called ginkgo. I don't know if you all have heard about that. Ginkgo biloba or ginkgo. But a lot of people take that for brain sharpness. A lot of women who are getting older, men and women, you know, they take it because they want their brain to be smart. Well, I did not know that this has anticoagulant properties, ginkgo. So it's like aspirin. It thins your blood. So now, if somebody's going to have surgery, I would be telling them, oh, you need to stop taking your daily aspirin for 2 weeks before the surgery, because, you know, you want to be able to cut. And then they go in and you can't stop the bleeding. And you say, what is going on here? I didn't tell them to stop their ginkgo. So that's the problem. You know, you're supposed to know everything, but I don't know everything. And that's the challenge.
Okay, question. Good evening, everyone. I was told, right, when women going through premenopause, they're very sexually active. And
well, I don't think the word is sexually active. It is your libido is up.
Well, they want, you know, a lot of time.
Yeah.
And then when it's actually finished now, they want to see the man no more.
Yeah.
True?
Right. So I don't think that perimenopause makes your libido go up. I think libido is it has a lot to do with the brain, and it has a lot to do with a lot of other things. Definitely, when you have certain hormones that are much higher, yes, your libido is up. And then when they fall off, the libido is down. But it varies. So I see it so different in so many different people that it's hard for me to say that's true. You know, I'm going to give you a joke, and I really hope, because Tyson, you say you're recording this? Yeah. I have to be very careful with my jokes, you know. Because I don't know who is going to see it. So I got to change up the story a little bit. But I have 2 patients. Once upon a time, I had 2 patients. One lives upstairs, the elderly one lives upstairs in a house like this. And the slightly younger one, who is menopausal, lives in a bungalow downstairs, across the way. And the menopausal lady got married. So she got married in her 50s. And both of them are my patients. And she did come to me and say exactly what you're saying. You know, I find my sex drive is up. And, you know, I find like I want it all the time. And which is great. Her new husband thought, this is great, you know. I mean, the children were gone, and part of it I thought was psychological. Here you are, you know you can't get pregnant, your children aren't around anymore, you don't have to worry about noise, you're living, you found this man you find attractive, and so, you know, I'm feeling great. Which was different, because a lot of women, when they go through menopause, don't feel like having sex. So I was like, go girl, I'm so happy for you. Well, my older patient who lives upstairs came to see me and said, Lord, Dr. Ferdinand, it's only upon top the fridge and I do it. And she is sitting on her veranda looking down into this lady's house and came to tell me. She knows that the patient in the bungalow is my friend also. So she'd see my car go there and she'd say, oh, I saw you visiting your friend. She said, Lord, you know, they need to put some curtains up. It's only on top of the fridge and I do it. So I didn't want to tell my friend that she was giving a old lady some kicks. But yes, it can go either way. And I think it has a lot to do more with the psychology than the actual physical thing. And I say that because, you know, I remember, for instance, when I had my son, a lot of us in the Caribbean, when we have our children, we keep them in our room, you know, in our bed, in our bedroom. Well, that couldn't work with me. No, if I kept my son in my room, probably all know so I wouldn't be having sex. he had to have a separate room. People said, what, Kathleen, you put your baby in a separate room? Yes, that's what monitors are for. You put them in there with the baby monitor, and then my life could go back to normal in my room. The idea of opening my eyes and seeing two little beady eyes looking at me was enough to turn me off. So, I couldn't do that. And that's just psychological, because my hormones were back to normal. It just, same thing with why a lot of people will tell you they have much better sex when they travel. Because when you travel, you're out of your routine, you're in a different place, you don't have to go to work, you don't have to cook, and so I think there's a lot of psychology when it comes to libido. Yes, there is a hormonal component for sure, but a lot of it is in the brain, so. And I don't understand. This is why I could never be a commercial sex worker. I could never be a commercial sex worker. Because for me, it's so linked to how I feel about the person. I could not just say, okay, put on my lipstick and walk down the road and say, hi, looking for fun, and go and have sex with somebody. I just could not do it. Thank goodness I've never been, had to. But I don't know how I'd manage. I would not manage. Because for me, it is so linked to the intimacy, to the person, how they look, how they speak, how they smell. Smell is a very important thing for me. You come around me talking to me, hi, pretty lady, and I'm smelling you from a mile away. We're not even having a conversation. So I don't know, Any other questions?
I just asking a question. I just make 50 in October.
Congrats.
Yeah. My period was coming regularly down the line, not like for 3 days and maybe a half, but when I reach in October, I ain't see it. And it come down in November, but not to say to go and pad. It's just like you just wipe and just
see it.
A little thing. So I worried about December now.
Not after tonight. No worries after tonight.
So I worry now if you're gonna stop.
It might.
For December, or you gonna come down, because in October, me see that it was going good coming down the line. So now I read 50. Me see it in October, none at all, and then just recently in November it come down, but not fully, just like you just wipe and yeah.
So it could just be a fluky month. It could be that you are perimenopausal. It could be that you're pregnant.
No.
Okay? So if you know what you're doing, if you could say, no, I'm not pregnant, why? And I ask questions. I say, do you think we should do a pregnancy test? And they go, no, I can't be pregnant. I say, how do you, I don't take anything for granted in my office. I say, how do you know you're not pregnant? And if you say to me, because I have not had sex since June 2021, then that's okay. Unless it's the second coming of Christ, of course, right? Okay. But if it is, well, no man, I can't be pregnant because I don't want to be pregnant. That's not a reason we're doing a pregnancy test. Because I can't be pregnant, I don't want to be pregnant, but I'm having sex and I still have periods and I've missed mine this month. Common things occur commonly, and it could be that. So if you know you're sexually active, you do a pregnancy test, and other than that, you say, I'm 50.
Sometimes my boyfriend will just come to me calm and I get angry. Yeah.
Welcome to the wonderful world of perimenopause.
Yeah, sometimes he just talk to me nice, but I just, angry. Yeah, blow out. Yeah.
Yep, so you should have brought him tonight.
Sometimes I don't get to tell him like this, like,
yeah. But again, why is that? Why you feel that? Is he younger than you?
Yeah.
Okay, because that's what I find. I've never understood so many women, I have one patient who takes the pill even though I think she's menopausal. Why? She wants her boyfriend to see her having a period. No, I don't want him to think I'm an old woman. And I'm fascinated, but now when I probe more, I realize he's younger. And it's kind of, in a way, dishonest. It's because I don't know whether he thinks she will one day have a child. She won't, because she's menopausal. She's only having a period because she's taking a hormone that's making her have a period. I'm talking about somebody who's 45, but she's menopausal. You see? So it's a tricky thing.
Yes,
so,
not cutting you off, as we talk about the period, she was getting so angry. I went to this family, tell her that, something to calm down me know that because me always angry, and it really worked, but after that I never take it again.
right.
She said we're gonna last for 3 days.
To calm you down.
Yeah, and it did work.
Okay. But now you know that irritability is unfortunately one of the things that can happen in menopause. And these swings, sometimes you feel happy, sometimes you feel sad. Sometimes you cry for no reason whatsoever. I think it's important, the communication, right? The communication with your partner, young or old, to say, listen, right? I may look this good, but I'm 50. And he's going to say, oh, what? You look fantastic. And you say, yeah, but you know what? Hand in hand with that 50 has some changes in my body, one of which is that my mood changes a little bit. So bear with me. Bear with me. The good times are going to be great, but now and again you might just have to go for a walk and step away. So communication is going to have to be the key. Yeah. Where did I put my handouts? A lot of these things are in my handouts, by the way. So I'm so glad I brought them.
So I'm touching again on estrogen and testosterone. A woman who have had the surgery of everything being removed. And as you explained, the estrogen level goes down and the testosterone that's already has been there becomes more
noticeable.
Yeah. Now, what I'm asking now is the added testosterone from the male by sex. No, I wanted to know by intercourse.
We don't get anything like that. We don't get your testosterone.
Okay.
No.
Well, I just wanted to get that understanding. By intercourse, does the woman get from the male?
No. Okay. The only thing we get from the male during sex is either pregnancy or sexually transmitted infections. We don't get anything else. Yeah. So, yeah. You change your mind? No question?
Good evening.
Evening.
Still a little late, but when in going up to hear many things as relates to menopause, you hear if you start to menstruate late, you go into that cycle late. If you menstruate early, you go into it early. So what I would like to make you think true to that, because back then when technology wasn't that advanced, we were taught by our grandparents. Now society has less grandparents and we are taught by technology. So I want to make you think true to that. And then at what age can someone start experiencing menopause? Maybe I'm thinking about the start age, but at what age it starts. And some of the things that you mentioned, like joint pain, pain in the hip, these are some things I will hear some of my workers talk about, so I will let them to be here. Unfortunately, some of them are answer. But I want to take up this information to them. So this healing drug, when school opens, God still like January, I want to say, we will be experiencing menopause. Now some of them they're not taught yet, but they're having these students when they want to know what age.
Okay.
And based on what we have learned growing up, that if you menstruate early, you go to early menopause. Menstruate late, I was just a saying.
Okay. So all of those things were in the earlier part. Yes, so, and I have no problem repeating them. So the first thing is about granny, what our grandmothers told us. They had a lot of wisdom, but they only knew what they knew. And we have come a long way, right? So, I believe that you must respect the elders for what they say, but we have access to more information, and with very polite way you say, I'm sorry, that's not true. So that's not true. We don't know how to predict when somebody will go through menopause. Whether they have a period early or late doesn't say they'll have menopause early or late. What does suggest if you have an early or late menopause is what happens to the females in your family, the primary females in your family. So you talk to your older sister, you talk to your mother, you talk to your grandmother, if she will talk to you about it, and you say, by the way, when did you go through menopause? And if you have a mother who says, man, I had my period till I was 60, then you're going to probably be late having menopause too. If you talk to your sister and she says, by 39 I was menopausal and you are now 40 and your periods are changing, then you're probably going to have an early menopause. What is early? So 35 onward is considered normal. So your hormones start to change from 35 on. So imagine, I wish I could draw, but here is my testosterone level. Here is my estrogen level at 20. And at 25, and at 30, and at 35. It's still here, but it's getting less. So I'm starting to get some of the symptoms of a decreasing estrogen. I may still be having periods because I still have enough estrogen, more than my testosterone, so I'm having periods, but I don't have what I had when I was 20. So I'm starting to feel some effects, perhaps getting the joint pain or the headaches. Then it gets to the level where it's now below my level of my testosterone. So my testosterone is higher, and then my period stops. So when my period has stopped for 12 months, right? So if I have a period today and I don't have one again until July next year and it comes, I am not menopausal. I may be perimenopausal, but I have to get from now, the 10th of December, to the 11th of December next year without a period, and then I can say, I'm menopausal. Now that may be arbitrary, but that's what we say. 12 months with the cessation of the period is menopause. And if after 12 months you get a period, you must see a doctor. Because it could be that you're just one of these freaky people that have the odd period after for some freaky reason, but more seriously it could be that there is a problem in your uterus. You have endometrial hyperplasia, which may mean uterine cancer or something. So always, once you've gone through your 12 months with no period and you're menopausal, you should not have bleeding again. And if you do, you go and you check it out, and the doctor will do a pap smear and a DNC and establish that this is just a one-off thing, And then the third part of that was the joint pains, the symptoms, and all of those things. So you could have joint pains because you have arthritis, right? And, you could have headaches because you're a migraine sufferer. But if you have, irregular periods all of a sudden, and headaches, and joint pains, and hot flashes, and vertigo, the room is spinning every now and again, you put one and one and one together and you get 3, right? So, I say if it walks like a duck and swims like a duck and quacks like a duck, it's a duck, not a chicken, it's a duck. So that's how you do it. You remember, we're dealing with human beings, and human beings are not machines. Human beings have a lot of variety, we're each unique, yet we have some similarities. So, nothing is hard, fast, cast in concrete. These are just things that we have observed over centuries of observation and record. Okay? So I have a leaflet, and you can take, because I think my secretary did a few, so you can take a few. so that you can share them with them. No. Only about 20% of people experience the hot flashes. Yeah, no. Some people don't. As I said, I haven't had them very often, but boy, are they something. I've had, I've been menopausal since I was 53. I'm 59 now, and in that time, I've probably had about 4 or 5 when I thought, what is this happening here? And then I work it out and I calm myself down and, and then it goes away. But it can be, it varies. Sometimes it's like a minute and it feels like a year because, you get lightheaded because what happens is your blood vessels open up and all the blood rushes to your skin. And you feel lightheaded because your blood volume goes down a little bit and you're hot and perspiring, my lip, everything, my shirt sticks to me in a flash. And then, you want to sit down and have water, and it depends on where you are. It happened to me in church once, and I'm telling you, I thought I was going to faint. And I'm sure, a lot of times women faint in church, and I'm sure some of it is that. But, you see? There you go. I'm telling you. Yeah. Any questions? Any more questions?
Doctor, I want you to speak to this area in regards to women in our diet. As you said that when our estrogen level drop, we are exposed to heart disease, diabetes, and these things come with other diseases with them. Affect your kidney, affect your pancreas, you're exposed to having pancreatic cancer, high blood pressure, and all those things. So I think that maybe you could speak to that a little bit.
Okay.
When you're in this stage, it's time for us to crack down and start eating better. And
right. So I just made one sentence about that, and I said we must start looking after ourselves, right? And so what does looking after ourselves mean? Well, we have to, let's look at a few steps. So what we eat. As you can tell, I love food. And so this is a little bit of a do as I say and not as I do thing. But you need to, and I love Coke. Yeah, I'm addicted to Diet Coke, I must confess. So, those are my vices, whatever. But eating, you have to eat balanced diets that are high in fiber, high in green, yellow, orange, red vegetables, low in starches, and mainly if you have to have starch, complex starches, which we don't do very well in this part of the world. These Windward Islands are much better. Grown provisions are the way to go. High fiber, they are carbohydrates, but they're complex, and so your body has to work hard to get them. White potato, rice, pasta, flour, sugar, very little of those should be in our diet. Those are not healthy. No, we have a problem because they are cheap. So that's the other problem. The vegetables are very costly, and that's what people know, in these times, they're eating. So what we eat is important, and you have to eat nutritious, balanced foods, high in fiber, because that gets your bowels working properly, right? High fiber diets. You have to consume a lot of water. We live in a hot climate. We perspire all the time. You have to replace your water. And some people say, well, I drink. Why I have to drink water? Well, drink has in color, sugar, other things. What your body needs is the water. So water is very important. Sleep, very important. Sleep is when our body regenerates and renourishes itself and corrects a few things. Our immune system needs that rest. My grandmother used to say, child, you're burning the candle at both ends, your resistance is going to get low. Well, she didn't know what my immune system was, but that's what she was talking about. Your immune system, if you're tired, will not work for you. So you have to get sleep. Now, there's no magic amount of sleep. We do think that 6 to 8 hours uninterrupted sleep is important. You can get by from time to time with less, but it's unsustainable. If you are not getting enough sleep over a period of time, you are going to get ill because of the effect on your immune system. So exercise, diet, sleep. Then I say there are screening tests that every woman at that age should be having. And what are those screening tests? So screening tests are tests that you have when you're feeling fine, but you go and you check on these things. You can't wait for the disease to jump out and grab you. What are those things? Your blood pressure, your weight, your breast examinations, your cervical pap smear. Those are essential, and all women over the age of 35 who are sexually active should be having those. And when you get to 50, there's another screening test we add, and that is a colonoscopy. A colonoscopy is a test to look into your bowel for bowel cancer. And the good thing about the colonoscopy is that once you have one at 50 and it is negative, you don't have to consider one for another 10 years. If it is positive, if they find something, the doctor will tell you, I want to see you in 5 years or next year or in 3 years. But the majority will be negative, and it's a 10-year thing. The colonoscopy is important because so many people present with bowel cancer, and bowel cancer is curable if it is caught early. So we start screening now before 50. There are other tests that you should be having as your screening. So stool tests to look at microscopic amounts of blood is one of the ways we screen for colon cancer also. So those should be part of your regular checkup. I mean, no woman at the age of 50 should be not seeing a doctor. I mean, not because I need you to help me pay my mortgage, but you need to start looking out for these things, because if you wait until it jumps out and hits you, it's often too late, especially with the breast cancer thing. Breast cancer, by the time you feel a lump in your breast, that is at least a stage 1. That's at least a stage 1. And stage 1 breast cancer, 5-year survival is 75%. So 75% of women who are diagnosed with stage 1 breast cancer, in 5 years, they'll be okay. But guess what? 25%, 1/4, will have died. And that's a stage 1. Now a stage 4, which I'm very sorry to say, I see so many women presenting with stage 4 breast cancer. And stage 4 breast cancer is the opposite of stage 1. So the 5-year survival of stage 4 breast cancer is 25%. 1/4 of women who go through the treatment and everything will survive. 3/4 who go through the treatment and everything will die in 5 years. Now, there is a stage of breast cancer called stage 0. And that's the stage that we see on mammogram. So every woman who is 50, I say 40, should be having a mammogram every year, because it allows us to pick up the changes in the breast before the lump forms, before you feel the lump. So they'll see the suspicious changes on the mammogram. The doctor will say, this looks suspicious, you need to biopsy that. You biopsy it, you find out it's cancer, you treat it. And stage 0, 100% 5-year survival. So, if God spoke to you and said, you have to have cancer, well, don't pick breast. If he gives you a choice, don't pick breast. If he gives you a choice, I would say cervix. If you had to choose, if he gave you an option to choose a cancer, I'd say cervix. But if he said, no, Kathleen, you have to have a breast cancer, then I'm going to say, okay, Heavenly Father, can I have a stage 0, please? And the only way I will know stage 0 is because I have my mammogram. And that's why it's so important. So we've done food, water, exercise, screening test. And blood pressure is important as part of a screening test. Because remember, with high blood pressure, right now in St. Kitts, the leading cause of death in St. Kitts is cardiovascular disease. And that has to do with high blood pressure. And high blood pressure gives no symptoms. We call it the silent killer. And it is that because A patient comes in and they say, Dr. Ferdinand, I have this rash on my hand. It's really itching me, it's bothering me. Can you fix that? And I say, fine, but let's check your pressure. And I end up calling the ambulance because the pressure is sky high. Or they come in and they say, oh, I have a terrible headache. Check my pressure for me, please. And you check it, it's normal. So you can't rely on symptoms. If you have hypertension and you're correctly diagnosed with hypertension, you have to manage it because it will kill you. It's as simple as that. It causes, the most common causes or complications of high blood pressure are sudden death, stroke, and heart attack. Now, none of those three do I want to have. So you got to monitor your pressure. So that's part of looking after yourself. Part of looking after yourself is, so I just think you need to once a year go to your doctor. And you say, I'm here for my well woman's check. And you check your blood pressure, you check your weight. When your weight is, again, I'm frightened of you filming this. Because weight is a tricky thing for me. Apart from the fact now I'm overweight myself. It's very difficult for many doctors, myself included, to talk about weight with patients. We're not talking about wanting people to be model thin. But we have to accept the risk that we have with people who are obese. And I have a test I usually say. I say, fold your arms. And if your hand, like mine, is resting on something, you have a problem. This centripetal obesity, right, is, see, you don't have that. But this, you see when I put my hand here, I have a nice little ledge. And that's not good. So that is called centripetal obesity. And we know that that is associated with an increased risk of cancer, of diabetes, of heart attack, of stroke. So we have to stop pretending. I saw a lady once upon a time, again, I have to be very careful with how I describe this, but you see, these are how I learn, and I remember these visuals. When she stood up from my chair, the chair stood up with her, right? My chair has arms. And at that time, my scale went up to 350, and I could not weigh her. She was over that. No, this was a young girl, and but her main problem was that her knee was hurting. And I actually wrote on her chart, morbid obesity. What does the word morbid mean? When you say something is morbid or morbidity, you know what it means? It means associated with death. So morbid obesity is when somebody is so overweight that just that alone can cause them to die. And it was very hard because yes, I could say to her, yes, your knee is hurting because you've got 350 pounds on your knee. And when you were created, it was not meant to carry 350 pounds. But that was not her. She had no concept. No, I have friends and relatives who say to me, God loves me the way I am. And, I don't want anybody body shaming me. And, and they make size 42 blouses. So you can always find something to wear. But we have to get real. It is not healthy. It is not healthy. And as we become menopausal, one of the things that happens is that fat gets deposited around here. And you see this, I think this is outside, but this is not outside only. This is around my organs. Inside my organs have fat around them. And that is not a good thing. So we should be trying to lose that.
I'm thankful we're done there. The MBI or BMI. Yes. Is it true that what we are using now is based on the Caucasian ethnicity?
Yes.
Because I went to a doctor 2 weeks ago and she weighed me. Well, I'm not comfortable with my weight, to be honest, because I have the understanding that it's measured by your height and your age.
Your BMI?
Yeah.
Yeah, BMI is your height and weight squared divided, one is over the other, and it's over 18.
Right. But she's telling me that I'm obese and That rests with me. That really rests with me heavy.
If your BMI is over 30, you're obese.
The thing is
by
that
definition.
I've been trying so many things. Dieting, changing, like no dairy, no sugar, starches out. So I'm like, so what do I eat?
Yes.
And she put me on a regimen of exercise, 150 minutes per week and so. But what she explained to me as well is that menopause does affect your weight gain. Because one time, I'm like, I'm not talking about within a week or even 2 weeks, I can gain or lose 10 to 15 pounds in a week or 2 weeks.
Scary,
I'm like, yeah. So
suppressing.
What do we really do?
Yeah, you do the best you can. You do the best you can, and the best you can is make sure you're eating. So, none of that sugar pasta stuff. I'm sorry to tell you, it's great to taste and it's cheap, but it is not healthy. So if you've eliminated those and you're eating the nutritious things and you're exercising, then you're doing the best you can. And that's all you can do. I don't know, I don't think I'm doing the best you can. I had sauce this morning for breakfast. And I loved it. So I know I'm not doing the best you can. And I had a Coke Zero at lunch, which is not healthy. So, but do the best you can. It's so frustrating. It really is frustrating. And a lot of people, I have a lot of women, when I say to them, look, your main problem is the weight. They say, oh, my husband likes me so. He likes to have something to hold on to. And I actually have got quite angry sometimes and say, he wants you to die soon so he can have another woman. I tell them that. Listen, if my walls in my office could hear, they would you'd be frightened what they tell you. Yeah. BMI, exactly. You see, that unfortunately, yeah, exactly. But the thing is, the physician should be able to adapt that for you. So, we have, without a doubt, black people, we have more dense bones. We know this because you know what? For years, you ever saw black people in every athletic sport except swimming. It's only recently a couple of black people are getting into swimming. We've never been in swimming, and I think it is that we take too much energy to get forward in the water. You think, so bone density plays a part, and the BMI is your weight and height calculated along with your age. So if you have dense bones and muscle mass, muscle is also a lot heavier, dense muscle than fat. So, somebody can be quite tall and slim looking and weigh a lot.
Oh, yeah.
So it can't just be the weight. We have to look at what you're doing. So if you're doing like me and having sauce and Diet Coke, that's bad, you need to change that. But if you're doing the best you can, yeah, so you're doing the best you can and you're probably healthy as anything.
One question here. A lady online said that she's 40 years, and she said most of the symptoms that you spoke about, she's just starting to experience them now at 40. Mm-hmm. What would you say to her?
Embrace it. Embrace it. I mean, the ones that you can treat and change, like the reducing your caffeine intake, the regular exercise, drinking lots of water, those sort of things. If you get a headache, you take something for the headache. That you have to treat the symptoms. But she could be perimenopausal.
Yes, she asked that question. She asked, is she perimenopausal?
She could be, and if she is perimenopausal, if she is perimenopausal, if she is perimenopausal, she'll know when her period stops for a year, right? But she is of an age when common things occur commonly. So she's over 35, you're having these symptoms, walks like a duck, swims like a duck, quacks like a duck, it's a duck. Yes. So those of you who can't hear, she's talking about headaches. And headaches, I mean, you can have headaches for a lot of reasons, right? And you can have headaches before you're menopausal. Right. So some people find that when they become perimenopausal, they start getting headaches. And some people like me who have had headaches since I'm 10, the headaches have got more frequent and more severe. So headaches are a horrible one of the symptoms to have. I mean, I have headaches all the time. My husband sometimes says, tell me when you don't have a headache. I have a headache every day. You know? Any other questions? No more questions? But everybody asks questions.
This lady right here, she said she's shy, but she said that she's been through menopause, she don't have a period, but she's not having any symptoms or anything like that. She says she's no symptoms, nothing.
Isn't that wonderful?
Isn't that, yes.
That's wonderful. And there's absolutely nothing wrong with you. You're one of the blessed ones. Lucky, lucky, lucky. My pastor today said he don't like the word luck. Look at that. Fantastic. Yeah. I mean, that's wonderful. You know, and sometimes you wonder if, you know, well, no, I don't. I never think that knowing is a bad thing. You know, some people say it's best when you don't know. I've never adhered to that. I always think knowledge is power.
Knowledge is power.
It is. And I think, but you know, so you know about it, and so what you must appreciate is how fortunate you are that a lot of your sisters walking around are struggling.
Yes.
And you know, you're going through, you're sailing through, which is great. Memory. Yeah. Yeah, memory, that is quite scary.
Yeah.
A lot of people get memory lapses.
Yes.
And the difficulty, again, just like depression, you know, memory lapses might be the sign of early dementia or Alzheimer's, but it could just be that the hormones are confusing your brain a little bit. And, you know, yeah. What happens to me, I go to, I can't remember where I parked my car. I come out and I go in one direction and say, wait a minute, you didn't park your car over here, and you go back another way. Or keys, I'm looking for keys all the time. Yeah, but you know, it's just, those are not going to affect the price of cheese, right? They're just things that you get over. But it can distress a lot of people.
Yeah.
It can distress a lot of people.
And that's the reason why we have this today, because a lot of women is asking questions. They're saying that, nurse, why am I not lubricating? Why am I disgusted? I beat the children for no cause. I'm just irritable, angry all the time, just full of anger, upset with everybody. You go on the job, you're vexed for what reason? They don't know.
Right.
They're telling the nurse, I feel my breast. They get scared because the breast always tender. Always tender. So, you know, I think this is something that...
A lot of women, you know, they tell me when they take off their bra, they come home and take off their bra and they have tremendous pain. You know, and that's part of perimenopause for some women.
Yes.
Yeah. Sorry? No. They have mastitis, inflammation of the breast, and it's common in menopause. Can be, you know. So it's just this period of change, and it's about wrapping your head around the change. And you know, some of us adapt to change better than others, and some don't. And this is, I think, a perfect example for where good communication helps. You know, sharing with other women helps. Communicating with your partner helps. Because, you know, it's different for everybody. And yet there are things that are similar. And so many times, I mean, I had one patient years ago who, she literally came in and said, I am going crazy, so what do I do? And when we teased out, it was that she was menopausal. She was actually 39.
Wow.
And, but we went through it and I said, you know what, you are going through menopause. I did put her on HRT and she emigrated. And I remember I was at a funeral a couple of years later and somebody tapped me on my shoulder and passed the funeral program to me. So I'm like, no, I have one, thanks. And they said, no, the lady behind there said to pass this to you. So I think, this is strange. And she wrote, thank you for giving me my life back. And this was very strange on a funeral program. And I'm looking back, and she had on a fancy hat, and I couldn't see. I was looking at her. Anyway, after we left the church, I looked to see who this person told me, and I realized it was her. And she said, listen, the hormone replacement therapy, that was what was wrong with me. That was what was wrong. And my mother, I actually put my own mother on HRT, because as I said, she started getting grouchy at about 55. And I couldn't understand. And then when I worked it out, I said, you know what, Mom? You're menopausal. And I put her on estrogen because she didn't have a uterus. And she also said to me, Kathleen, I feel like myself. I don't know who that was. I just felt totally not like me. And, you know, and I know that for myself now. I definitely, when I do not take my HRT for about a week, I behave differently. I feel differently. But I have no uterus, so I don't have the risk. It's not something, you know, a woman who goes through menopause naturally taking HRT is not something you can do without discussion of your risk. So it's not something I promote, really. Okay. Yeah.
Is there a connection between menopause and Alzheimer's?
No. Not as far as we know. But the two can happen, right? There are menopausal women who get Alzheimer's, and there are women with Alzheimer's who will become menopausal. Alzheimer's is no set time. Alzheimer's is a disease. It's a disease, and it's a scary disease. When I entered medical school in '83, and in '83, we knew of something called senile dementia. And then younger people started getting it. Well, senile means old, right? Senile means old. So this is dementia of the old. And suddenly a 50-year-old person had the same symptoms. And so we called it, back in '83, senile dementia of early onset. That's what we used to diagnose it as. Well, now that whole umbrella is called Alzheimer's. And we really don't know a lot about Alzheimer's. Pardon?
You don't have the STEMI anymore?
Don't have?
The STEMI Alzheimer's? The STEMI?
Semi?
No.
Alzheimer's.
Yeah, Alzheimer's. And now, you know, the whole umbrella is now called Alzheimer's, and we don't know why it happens. I mean, they're doing a lot of research. There are proteins or something collecting in the brain. You know, I mean, my husband has Parkinson's disease. And Parkinson's disease is that disease of tremor. But 35% of people with Parkinson's get Alzheimer's. And that is a scary figure. And so, you know, I'm constantly looking out. You know, and in fact, every time we go for a neurological assessment, you know, they ask him questions all the time, memory questions. And then they take me separately and ask me, you know, am I noticing things? Because there is a condition, I can't remember what they call it. It's not called Louise, it's called, it might be Louise disease. They put the two together, and it's now been given another name with people with Parkinson's and Alzheimer's. But it's a big amount of them that get it. So it's, you know, but memory lapse is part of the menopausal scenario, unfortunately. Yeah.
Any more questions? Well, thank you guys. Dr. Ferdinand.
Thank you. Let me give the...
I just want to take this opportunity to say thank you. Let's give her a round of applause, please.
Each and every one of you, I want to say a special thank you.